This has a potential, I should say, to dominate the pandemic in British Columbia going forward.
The P.1 variant of COVID-19 is highly infectious, and it could cause more serious illness in young people. Now, British Columbia has the highest concentration of this variant outside of Brazil, where it was first identified.
And we now have 877 confirmed cases with this P1. 106 of them are active cases, so about 1% of these cases, 1.2%, are now active. And the majority of the P1 that we're seeing in BC are people who reside in the Vancouver Coastal Health Region.
Dr. Henry says as more transmissions occur, a virus has more chances to mutate and become more robust. Compared to the original strain of the virus, the P1 variant spreads 2.5 times faster and may affect younger people more severely.
This causes more severe disease. So these individuals are not only getting infected in larger numbers, they're getting hospitalized and even requiring care in the intensive care unit. And we know that some players of the Vancouver Canucks that are infected with the variants are very ill at this time.
So how did BC end up with the highest concentration of this variant?
It made its way into Whistler, where it was able to rapidly spread in the population there. And then because Whistler is kind of like a place where people go and come back from, then that's allowed it to move around into the rest of the province. So that's sort of the epidemiological reasons why it might be spreading a little more. It's just happenstance of getting into a place that happens to have a lot of connections to the rest of the province.
The province has continued its work on identifying the variants of concern in BC.
We've seen as well that we've done a lot of testing for variants in British Columbia. We've had a strong whole genome sequencing program where we started very early on, and we've presented that data from the very beginning.
But some say the current number of tests isn't enough and that the reported number of variant cases is likely lower than the reality.
We do less testing than anywhere else in Canada. We're well below 10,000 tests a day. We can do 20,000 tests a day, and this is the time to do it, so that we can identify transmission networks, especially those that involve the variant, and interrupt them.
Dr. Conway wants to see vaccines used to target populations where variants are spreading.
These are the keys to us getting a handle on the P1 variant in particular.
In Vancouver, Kier Junos, City News.